thank you for the invitation to speak to your academy. So Zycha is the Ukrainian word for life. And the CEO of our company is married to a Ukrainian woman, and she had the only vote to name the company. So we all kind of stood back. We've been that, and it is a difficult name to pronounce, but it's Zycha. So today I'll spend about 45 minutes talking about a biological product, human FGF1. This is a biological protein. We all have it in our bodies, and we're developing it to look at a number of neurodegenerative diseases. And before I get into the brain, I'm going to talk a little bit about some human clinical trials we've done with this growth factor in regenerating skin, healing diabetic foot ulcers, and also growing new blood vessels in the heart. We have FDA trial data on regenerating coronary arteries in patients with severe coronary artery disease. So what does this growth factor do? It stimulates the process known as angiogenesis. This is the process of growing new blood vessels in our bodies. So the FGF1 is probably the most potent stimulator of angiogenesis known. It also stimulates the formation of small arteries, arteriogenesis. So there are over 75 human diseases that result from a lack of blood flow. Some are obvious: coronary heart disease, stroke. But more recently, we and others have found a lack of blood perfusion in the brain to certain areas of the brain can initiate neurodegenerative diseases such as Parkinson's disease, ALS, and even Alzheimer's. So I'll talk about that towards the end of my talk. And also at the very end, I'll refer to a really nice study that was done at Columbia University that talk about how as we age, a lack of blood flow in our brains causes underperfusion of our cerebral stem cells, leading to some of the worsening functioning of our brains as we get older. Okay, angiogenesis, just for those of you who aren't familiar with it, we use it every day. The skateboarder scraped his arm. If we look under that region of the area that was damaged, here's angiogenesis. These are all brand new blood vessels, which were stimulated by the drug we're developing, FGF1, regenerate skin as an organ. So sweat glands, hair follicles, nerves, whatever you need to regenerate skin. And we're using the same natural product to treat human diseases. Here is FGF1. It's a protein. I actually was involved in purifying this at Washington University in St. Louis a number of years ago when I was a graduate student. We go down to the slaughterhouses and get cow brains, and this is where FGF1 was first identified. We're not using, obviously, cow brain FGF1 in our clinical studies. We make it in a facility. This is an FDA approved facility, so we can get unlimited quantities of this growth factor for clinical studies. So again, for those of you who aren't familiar with it, when we injure ourselves, cut ourselves, the body makes FGF1. It binds to FGF1 receptors that are located on already existing blood vessels, as shown here. This potently activates endothelial cells to begin dividing. And here we get a tube formation. And in the very beginning, brand new blood vessels growing into the region of either wounds or in the heart, ischemic areas. Important point I want to emphasize, there's an upregulation of the receptor for FGF1 after we have damage. So it's this upregulation which allows this whole angiogenesis process to proceed. Again, here's the receptor for FGF1. FGF binds, you get this